Hello. Today my group will be talking about alcohol abuse in our society for our group assignment. To begin, I'd like to describe what alcohol is. The World Health Organization defines alcohol as a psychoactive substance with dependent producing properties. Alcohol, much like other substances such as recreational drugs, can cause a huge deficit in an individual's health. While the occasional drink here and there has a minimal to non-existent effect on a person, frequent consumption has shown to increase the burden of disease. Alcohol has also been shown to be a leading risk factor in terms of personal death and disability. Alcohol doesn't only affect the consumer, it also affects the consumer's social network, friends, families, and co-workers. There are many factors that influence a person's reasons for why they may consume alcohol, such as, but not limited to, societal factors like work, finance, or culture, and individual factors such as age, gender, or family circumstances. While alcohol is viewed by many as a social gathering component, there are cases where alcohol consumption takes a step too far. People who are overly stressed, struggling in their lives, or are unsure of where to turn often gravitate towards alcohol due to its dependent producing properties. It brings a sense of relaxation when consumed, allowing for temporary relief from stress, anxiety, and pain in some cases. Inevitably, this becomes an incentive to alcohol abuse and many fatal consequences from there on. Why is alcohol abuse an issue? Alcohol abuse is a continuous pattern of drinking that can affect a person's day-to-day life. Studies have shown that interventions can aid in reducing a person's alcohol intake, but a more prominent role is needed, as some require extra support. Alcohol-related diseases are contributing to higher mortality rates each year. The National Institute on Alcohol Abuse and Alcoholism reported that alcohol contributes to more than 200 health conditions worldwide, and over 3 million deaths globally each year, which is 5.3% of deaths overall. Alcohol abuse can cause a variety of different diseases, both physically and mentally. Mental disorders such as depression are often associated with heavy alcohol abuse, as well as physical complications such as high blood pressure, cancers, various liver diseases, and chances of experiencing strokes. Liver disease is one of the most prevalent health issues that arise from alcohol consumption. For 90% of absorbed alcohol is metabolized in the liver, inevitably playing a huge role in the amount of alcohol-related morbidity and mortality rates. Alcohol use is always a prevalent topic in the media. Earlier this year, alcohol bans were reintroduced in Alice Springs town camps and surrounding community areas. Senator Jacinta Nampijima Price spoke about the loss of her cousin the previous year, a loss resulting from alcohol abuse. Alcohol had been reintroduced into town camps, with Senator Price describing that the town camp had become absolutely unbearable due to its reintroduction. Consequently, alcohol-related crimes began rising back up to prevalence, leaving many individuals within the vicinity powerless to the bottle, according to Price. Domestic violence was also spoken about in association with alcohol abuse. Assistant Minister for Indigenous Australians, Balangiri McCarthy, spoke about how she took care of her mother for over 10 years during a period of domestic violence suffered from her then partner, before she eventually went into renal and kidney failure. Overall, the article spoke about how alcohol had damaged and taken the lives of loved ones and others who they hadn't expected to leave them so early. With alcohol bans being reintroduced, there were hopes that things would de-escalate in Alice Springs, but it brings the attention of other places not only populating Australia, but around the globe.
The Ottawa Charter for Health Promotion, established in 1986, is a landmark model in the field of public health, emphasizing a proactive approach to enhancing well-being. The model revolves around three key strategies: Enable, Mediate, and Advocate. Enable focuses on empowering individuals and communities to take control of their health by providing them with the knowledge, resources, and necessary skills to make informed decisions and lead healthier lives. The principle of Mediate highlights the intermediary role of governments and organizations in balancing competing interests and resolving conflicts to promote health. It highlights the importance of bridging gaps and facilitating collaboration among various stakeholders. Advocate underscores the need for health promotion advocates to champion policies, practices, and initiatives that advance health equity and well-being, often by raising awareness, mobilizing support, and influencing decision makers. In addition to these strategies, the Ottawa Charter outlines 5 key action areas. The first one being building healthy public policy, which entails creating policies and regulations that promote health across all sectors. The second one being creating supportive environments, which focuses on designing spaces that enable and encourage healthy choices. The third one being strengthening community action, which involves engaging communities in identifying their health needs and developing solutions. The fourth one being developing personal skills, which emphasizes education and skill building to empower individuals to make healthier choices. And lastly, reorientating health services, which advocates for healthcare systems to prioritize prevention and address social determinants of health. Together, these strategies and action areas form a comprehensive model that not only addresses health as the absence of disease, but also as a holistic state of physical, mental, and social well-being while satisfying the 9 prerequisites. The Ottawa Charter envisions collaboration across sectors and underlines the importance of creating an ecosystem supportive of health, striving to extend lives through enhancing their quality, equity, and overall satisfaction.
As discussed earlier by Adil about the key framework model of Ottawa Charter, now I'm going to discuss about the strategies and intervention against alcohol abuse. One of the primary strategies to address alcohol abuse is the development of healthy public policies. It involves regulating advertisements and controlling the promotion of alcohol. Additionally, reforming a whole taxation policy is also crucial in decreasing alcohol consumption. The government can increase the taxes on alcoholic beverages, making them less accessible and therefore reducing consumption. Moreover, revenue generated from alcohol may be used in other health-related programs. Another strategy can be addressing alcohol abuse in Australia is the creation of supporting environment. This involves initiatives like promoting RSA, which is responsible service of alcohol, which is a training for staff in areas where alcohol is sold, like bars and clubs. Secondly, developing programs and campaigns aimed at reducing alcohol and violence amongst the adolescents is vital, which is associated with alcohol abuse, and it is used to educate the public as well. The third important strategy is the strengthening of community action, in which encouraging local communities to organize events and activities that may promote healthy lifestyles is a community-based approach. These events can serve as a platform to raise awareness about alcohol abuse and provide resources for those seeking help. Importantly, these initiatives are especially crucial in regions with the rates of high alcohol abuse as they address localized issues and promote community engagements among the people. Some interventions introduced by the Australian government are, for example, online support. For example, the Queensland government has provided ADIS services, which is Alcohol and Drug Information Services, which is an important component of Australia. Australia government opposed to tackle alcohol abuse. ADIS offers confidential assistance with vital information amongst the individuals related to alcohol-related issues. It's a 24/7 service and plays a crucial role in providing immediate support, and it is a valuable platform for treatment options against alcohol abuse. Alcohol-free zones. The creation of alcohol-free zones in public spaces and parks by the government represents a proactive step to curb alcohol abuse. These areas provides a safe, family-friendly environment where it is called consumption is prohibited. Such zones has been instrumental in reducing alcohol abuse and violence related to alcohol. For example, the city of Melbourne has banned alcohol in public spaces 24 hours a day and 365 days a year. One of the major interventions are the implementation of lockout laws. In nightlife, such as Melbourne clubs in Sydney has transformed late night safety. These lockout law These lawsuits have entry to licensed venues after a specific time, reducing wireless and alcohol-related incidences. These provide clear framework for responsible drinking late nights and the overall security of in the entertainment districts. For example, the lockout laws are enforced in Sydney by the New South Wales government from February 2014 to January 2020. In the CBD and the Oxford seat, it has a positive impact on public safety in reducing alcohol-fueled violence. Thank you.